Do you ever feel a sudden strong urge to take something even when you don't need it, and it's not yours? Imagine walking into a store seeing a cheap pen and suddenly feeling a wave of tension that only goes away when you secretly slip it into your pocket despite being able to afford it. That might sound like stealing, but for some it's a mental health condition called kleptomania. Unlike regular theft, people with kleptomania don't steal for personal gain or out of anger. It's more like an uncontrollable pull, followed by guilt or shame. Have you ever done something impulsive like that and wondered why? So why does someone develop kleptomania? It's not about being a bad person or growing up in a tough environment, even kind, well-off people can have it. Experts believe it's linked to brain chemicals like serotonin, which helps control moods and impulses. Low levels might make it harder to resist urges. Think of it like a car with good brakes versus one where the brakes fail suddenly. Some people may also have a family history of mental health issues, like depression or addiction. For example, meet Sarah. She never stole until after a serious car accident. Brain scans later showed changes in the part of her brain that manages self-control. So injuries, genetics, or imbalances in the brain can all play a role. The big sign is repeatedly stealing things you don't need. But here's the twist: the items are often small, like hair clips or gum, and sometimes they're even thrown away or given back later. Before stealing, the person might feel growing tension or anxiety. During the act, they feel relief or even pleasure, like scratching an itch. Afterward comes guilt, shame, or fear of getting caught. Let's say John buys a coffee and suddenly feels restless. He picks up a spoon from the counter and pockets it. He doesn't need it, and it makes him feel awful, yet the urge comes back. These patterns happen over time and cause real stress in life, relationships, or work. There's no blood test for kleptomania. Doctors diagnose it by asking detailed questions, like how often the urges happen, how the person feels before and after, and whether the stealing is planned or impulsive. They also check for other conditions like bipolar disorder or OCD, because they can look similar. Treatment: therapy helps a lot, especially cognitive behavioral therapy (CBT). In CBT, someone like Maria learns to catch her urge early and replace the stealing impulse with healthier actions, like squeezing a stress ball or calling a friend. Sometimes medicines like antidepressants are used too. Support groups also help people feel less alone and more in control. You can't prevent kleptomania like a cold, but you can reduce its impact. The key is early help. If you or someone you know has these urges, talking to a counselor early can stop the cycle before it grows. Practicing mindfulness, like noticing urges without acting on them, can build self-control like training a muscle. For example, Alex started journaling when he felt the urge to steal. Writing it down helped him pause and choose better. Avoiding high-risk places, like stores where the urges are strongest, also helps. Support from family and education about the condition make a big difference too. Recent studies are exploring how brain imaging can help diagnose kleptomania by spotting differences in impulse control areas. Some researchers are testing new therapies using apps that send calming messages when users report urges, like a digital coach. Others are studying medications that target specific brain chemicals tied to compulsive behaviors. One 2023 study showed that combining CBT with mindfulness training reduced stealing episodes by over 60% in a small group. While more research is needed, these advances offer real hope for better, personalized treatments in the future.